Out here in the Midwest, it can be really hard for men to get the support that they need. People are living in remote towns with small populations. They're out on farms or mine sites or out at sea as fishermen, and it can be really hard to make connections in that environment. We want to fill that gap, empowering local people to support each other, upskilling health professionals across the region and decreasing stigma in the community. So the suicide prevention trial for the Midwest is concentrating on men aged 25 to 54 years, and for us that includes farmers, fishers, FIFO workers.
There are a lot of difficulties I perceive associated with farmers and accessing mental health. The job itself requires you to be fully self-reliant. It's not just yourself, you've got stock, you've got a whole operation dependent on your getting up and functioning and getting the job done. I think Australian men generally are expected to be self-reliant, and it's not very blokey to need help or support. You just push on and get done what has to be done. And farmers hate the idea of being judged. I think it's too easy to compare yourself and your success and results to the bloke down the road or the bloke next door, or you don't want to be judged on something that you invest your whole life into that is you if it's failing. It feeds very much into the whole don't look for help, just do it yourself. Put in as much of yourself as it takes to get it done and get it done successfully.
We drive all over, running community education and supporting community projects. Our goal is to upskill communities to be able to support themselves through times of crisis and to help each other through hard times. I worked it out the other day that we've done over 21,000 kilometres this year, 2019, which is Geraldton to Brisbane 5 times. That's amazing. Good job, I enjoy driving. We support a number of community projects, one of which was the Shinema project with Chapman Valley Men's Shed. And the concept for that is to bring community together to reduce social isolation and have a fun time.
There's lots of men that come home and can't really talk to anyone about the real issues. And I think men's sheds are a little bit more geared for that, where people actually come because they want to talk about stuff. There's lots of communities that are bleeding out and there's not many jobs and there's not much to do. One day Ralph came back and bought a bus for the men's shed, and it was an absolute wreck. So it was good fun to fix it and then to take it to Malaga for the first time and show a movie. It was great. I think it's a fantastic opportunity to bring people together, and it's not just the bus and the movie. It's like there's live music before. Now we try actually to have local clubs doing the cooking. So it's a bit of a collaboration. Everybody gets something out, and for the people there's something to do and something different. The men there did most of the work, and I think they're incredibly proud to see the thing get off the ground.
We also do a lot of education for health professionals. They're a really important part of the suicide prevention trial, and we want to make sure that they feel confident.
As part of that trial, Jeff Riley, who's a past head of the Rural Clinical School, and the Dean of Medicine has been coming up to do some training with my registrars. I've had 10 registrars this year, and over the last 3 years he's come up every year and helped us deal with common problems in general practice, including depression, anxiety, and obviously suicidal ideation. And I think it's been really helpful to have Jeff come up here and train my registrars. I think general practice is critical to provision of mental health services. We're the point of first contact for patients with mental health issues. We generally have the resources, we know where the best resources are, we can understand the acuity, we have access to the hospitals. So general practice is core to mental health provision, yes. I think living in remote areas, certainly rural locations, brings a lot of challenges in terms of mental health. both in terms of distance from specialists, also manpower in terms of providing adequate support and help. I think there's a definite disadvantage, and it makes our job more difficult in the rural areas.
So we also run, as part of the trial in the Midwest, a media awareness campaign so that people know where to go to get help if they need to, especially those people in the smaller, more remote communities. We've got coasters in pubs, advertising at the fishing wharf, hardware stores and in mine sites, trying to get to the men who are at risk.
As part of the trial, we've noticed a definite increase in the number of services rendered and the people coming in for services. People are more willing to talk about mental health issues, and they're more willing to come for help. And we've also got more resources that we can offer them.
If we decrease stigma in the community, support local health professionals and empower local people, we can make a real difference in the lives of men in the Midwest. This is what the Midwest Suicide Prevention Trial is all about.